Thank you. Under Committee Rule 9, we will now ask questions of witnesses under the 5-minute rule, and I'll recognize myself first for 5 minutes. My first question is for Mr. Simondera. Under the FICA program, you mentioned that injured workers with dependents can receive augmented compensation at 75% of their wages, and for some FICA beneficiaries, a 75% tax rate wage loss benefit exceeds their pre-injury gross income. Do you see or have you studied at all how this may serve as a disincentive to return to work?
Well, it certainly could be a disincentive. As you said, if you look at the actual take-home pay, it can be higher under FICA because you're talking about, with augmented compensation, 75% of the pre-disability wage, tax-free, and without many other payroll deductions. Now, you can't receive your normal federal salary increases. You can't get a competitive or a merit raise or promotion while you're on FICA. But you do receive an annual cost of living adjustment, even in years when federal employees that are working do not receive an adjustment. And so certainly this has been identified as one potential disincentive for some injured workers to return to the workforce.
Your written testimony also notes that the workers' compensation program in 38 states and the District of Columbia, as well as federal longshore programs, have set their benefits to 2/3 of a worker's gross wage with no augmented compensation for a worker's dependents. Can you discuss how those programs are performing in comparison to FICA, and what can we learn from those state models and the federal longshore program?
It's always should exercise caution when comparing the state workers' compensation programs and even the federal longshore program with FICA, because there are differences that go beyond even the level of compensation. For example, most workers in this country receive workers' compensation through state programs and through private insurance companies. There's a private insurance company. Thus, it is a more adversarial model than what you have in FICA, where you're dealing only with the Department of Labor. States, as was mentioned by the Postal Service Inspector General, states have options for lump sum settlements of claims. FICA does not. Many states have caps on benefits, either a total amount or an age cap, which can essentially force people off the rolls and to work. In addition, majority of states limit the choice of medical provider. Again, in FICA, you have a near unlimited choice of treating physician. So I think when you compare FICA to the states, and you want to say, well, are states putting more people back to work? Do they have lower benefit durations and things like that? It's important to look at the whole package of benefits under FICA, and I would say, generally speaking, FICA is more generous in its benefits and administration than what you typically see in the state workers' compensation programs or even in the federal Longshore and Harbor Workers Compensation Act program.
Next, I'll go to Mr. Santos. Your written testimony highlighted many examples of medical benefits fraud and the impact on prescription opioid abuse on the FICA program. The Office of Inspector General's audits have provided critical assistance to DOL to help solve those problems. What further reforms would you recommend to further curb medical fraud within the FICA program?
Thank you, Mr. Chairman. I will preface my response by giving OWCP quite a bit of credit for their progress over the last 10 years. As a result of many of our audit oversight work, as well as a result of our investigations and working closely with Postal OIG and other OIGs, OWCP has taken several actions that have resulted in improvements in both the prevention of improper payments and fraud, as well as the overall management of the program. In fact, we've seen both as it relates to the management of compounded drugs, the actions they took in response, as well as the management of opioids in the program, significant progress on the part of OWCP. Having said that, there are two recommendations that we have to Congress that we believe would further strengthen the program and provide OWCP with additional tools to prevent improper payments and fraud in particular. The first one is to authorize OWCP to access Social Security wage records, as well as the National Director of New Hires, which provides contemporaneous information about employment of individuals in the United States. And in doing so, would afford OWCP the opportunity to cross-match that information to identify underreporting of income or outside employment. We've also recommended, and this is a long-standing recommendation of the OIG, for OWCP to be authorized to suspend medical providers who are indicted for fraud involving the FICA program. Under current law, OWCP can continue to pay for services being provided by medical providers that we or other OIGs have indicted with crimes associated with fraud against the OWCP program.
Sounds like some good recommendations there. Thank you. With that, I will conclude my time, and